What is up, health enthusiasts? It's Coach Lambie here for Working Weights LLC, your guide to strength, health, and all things nutrition. I'm joined, as always, by my co-host, Dwayne Ulrich, aka Poppy Dwarrell.
Good to see you.
Today we are talking about essential oils.
Essential oils.
Yes, and yes, everyone, I do have a shiner.
I'm not seeing anything.
Yeah.
You got into a fight with a girl on the playground.
Yeah.
They're fighting over the monkey bars.
Teenagers.
I didn't realize I'd laugh this hard.
Yes, so little known fact, most gym injuries are not lumbar spinal injuries and patellar dislocations. It's you dropping stuff on yourself.
Enough said.
Enough said. All
Enough
right.
said. Moving on.
First things first here, reels.
It's real time.
Yeah,
I love
what
all
he's
those
saying.
fruit. Make sure you get me putting the money in. Let's go make something.
So, we're going to make a condiment called kosho. Usually it's made with uzu. Today, we're going to make it with these oranges, mandarins, and limes. But first, we need some chilies. Normally shishito, they're kind of hard to get. I'm going to use some jalapenos today. But you just want a green chili.
She knows I can't do hot peppers.
That's funny, dude.
Tops off, in half, take the seeds out, and dice them super fine. Next step, we're going to weigh the chilies that we just chopped up. So we're looking for an 80-20 ratio of chili to zest. So I've got 70 grams of chili here. I'm going to put about 17 grams of zest in. First of all, make sure you wash your fruit. Hot tip, don't be lazy and just put these in your fruit bowl, cut them open, juice them now, chuck it in the freezer, or they will go off real quick. So now we've got our 87 grams in total weight. We want 2% salt, which is about 1.7 grams. Give it a mix so the salt is evenly distributed. Place it back on your board and chop it up even more. You can kind of take this as fine as you want, but I'm happy with that consistency. And that's pretty much it. Place it into an airtight container or jar and into the fridge for 3 to 5 days before you eat it. Perfect on a grilled piece of fish, grilled piece of chicken, part of a salad dressing. Delicious.
It's a good thing I can't get pregnant anymore because Walmart had these little numbers on sale for $4 and I bought 3. I'm irresistible in this thing. And the breeze, unparalleled. Hannah, that's for grandmas. Well, grandma had 15 kids, so she knew what was up. I know these are like moo-moos or night shirts, but we call them hitch 'em up dresses. Now, anytime you gotta get and you just hitch 'em up, hitch 'em up, hitch 'em up, hitch 'em up, hitch 'em up. Not to give you guys too much information or anything, but it's been many a year since I donned anything.
I think we're past the too much information point.
A little lazy, but I got that special brand of husband that don't particularly care because he likes them mean, thick, and a little bit wild. Put this little number on last night, and I was standing like this over the air conditioning unit, and he walked up and he was like, what's this? The addition of this night where I'm getting real close to fully realizing my final form as a feral mountain mama. I've been taming down crows. I leave peanuts on the porch railing, and they come and land on my porch railing, and I've been slowly acclimating them to my presence. What would you think to yourself if you saw a barefooted woman wearing one of these and we're standing out on her porch in the middle of nowhere surrounded by crows? That is exactly the vibe I'm going for. Whatever it is, that's the vibe I'm going for.
Okay. Yeah. That's how it goes, too.
That's like a cat trying to get some food in there.
That's right, man.
I'm sorry. I didn't know where this real show was going. You start out with that dude and the I don't know, the jibber jabber, and then the mixologist, go.
Stuff my
But
wife
the-
sends me.
The gal takes the cake. Literally, you ever see those?
Would she call
animal
herself a
videos?
feral mountain mama?
Yes, she did. And that look she's going for with the crows.
That
And then the
lady
man
lives
going,
in
it's
my
like,
neighborhood. Not that
no
lady on the
way.
reel. Not that lady on the reel, but
Oh, okay.
the lady who stands out in a muumuu. So there's a lady right down the street. The crows are wild up here.
Are you
Uh,
serious?
yeah, it's just nothing but crows. I want to make a meme of like a bunch of shadow images of different birds. And it'd be like all the birds that you see in the White Mountains, and it's crow, 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 crow. Even though because you drive down the road and you're like, "What's that?" And you think it's a hawk or an eagle because we do have hawks and eagles and ospreys and stuff, but it's a crow. It's always a crow. Anywho, in my neighborhood, the crows are numerous and voracious, but there's a lady 2 streets down who feeds them, and they all congregate. There's a murder on her fence post, and it's covered in bird poop. Oh, it's disgusting down there. But yeah, that vibe, that lady with that vibe lives down the street from me. Just a little old lady with her crows.
Oh my gosh, man. I'm I'm blown away. I'm blown away.
Yeah.
I'm gonna ask her to email those last two to me. Or text them, send them to me. I gotta
I'll
show
send
them
them
to
to you.
Kathy. I
I'll
gotta
send
show them
them.
to Kathy, dude. That's
Yeah.
that's gonna blow her mind, bro.
Yeah. All right, man. Essential oils. Are
Gonna
they
need some
good
essential
for
oil after all
anything? Yeah.
that.
Need some essential oil after that. So this is something that I've wanted to look into. Now we talked about using the essential oil for sleep, for aromatherapy, stress relief, sleep, and all that stuff. Seems to be pretty good evidence there. Christy at one point in time was pretty into them. And I was always kind of like, yeah, I mean, other than smelling good, like I'm not really sure what they're good for, right? So I looked into this, and I honestly, like, I went into this thinking that I was just going to find a bunch of nonsense, but
Yeah. Yeah, me
I,
too.
we're pretty surprised here. So let me share this
Yeah.
first one here. So talking about aromatherapy. So obviously we saw some good stuff with sleep and stress reduction, stress management, all that stuff, but also just helping in reducing pain here. So this systematic review and meta-analysis looked at the use of aromatherapy, so essential oils, in conjunction with conventional pain treatments, conventional pain management. And they found that compared to placebo, the use of aromatherapy actually helped with reducing pain after surgery and stuff. So
Yep.
pretty
Yep.
good.
Yep.
Pretty good stuff here. And
Yeah.
it's so they a lot of these used in reporting visual analog scales. And so what that is like it's a line that's a known distance. So like let's say it's 100 centimeters or 100 millimeters long. And so, 0 would be no pain. And at the other end of the scale would be like, I'm dying. And so you'll ask people to rate their scale, like put a mark somewhere on this scale where you think your pain is. And it's actually a pretty accurate and validated method of doing stuff. So, yeah, man, interesting to find here in the use of pain. And you can see like so the reduction for treating nociceptive and acute pain. So that would be like sharp pain that comes up versus the inflammatory or chronic pain. So still a reduction in inflammatory and chronic pain, but not as much as like pain that comes up like all of a sudden your knee hurts or something like that. Almost double the effect of that. So,
Yeah.
but findings of the study indicate aromatherapy can successfully treat pain when combined with conventional treatments, and that's a key thing there in that one. So I think that probably has, not that I think that breathing in the essential oils, and they're also a part of aromatherapy is also rubbing it on your skin or something. Ooh,
By
have to
the
relight that.
by the way,
Yeah.
so we talked about the blue tansy for sleep aid, and called a guy I knew, and he said to meet this guy down, off of Jensen about 2:30 in the morning, if he could get me some blue tansy. So I don't think we're talking about I'm not talking about the same thing, man.
Not the same blue tansy. No, you can order it online. You don't need to meet anybody.
So yeah.
Yeah.
So going forward, because in my study, I found I was finding these same things about that it's legit, and depending on the type of pain, and also using it with conventional pain mitigation. But there were also I also looked at the things that the do's and don'ts. So we were talking about rubbing it on there, and you'll get to all this, but just so you know that I looked at it from a don't do this side, which is, you would think like, oh my gosh, there's some downfalls, and well, there kind of are, and we'll get to it. I don't mean to jump ahead. If I'm jumping ahead, just let me know. There's like you can rub it on you can rub it on your skin, but some things you don't want to rub on your skin, or some people are allergic to certain things. I also found some things about where people, because we were talking about the diffusing and inhaling, and stuff like that. Some of the stuff can irritate you, and there's also some combinations you don't want to do. But overall, all the studies I read were like, yeah, it works. It works. People probably shouldn't go out developing their own essential oils. Some plants are toxic and poisonous. So, but yeah, it's a big deal. It's a big deal. Go ahead. I looked at the NIH. I took a deep dive into the NIH meta-analysis. But go ahead. I digress. I gave you time to light your cigar.
Yeah, we'll talk about the don'ts. So there's not a lot of research into all of the different essential oils that you can buy, and there certainly is very, very limited evidence on combining essential oils. So as you're talking about there, and a lot of people will sell blends, or people will create their own blends. Not a lot of stuff out there on that. And I could find plenty of evidence on using certain essential oils for certain things and having no outcome from those things. But I did find stuff that did have some positive effects, and I kind of wanted to highlight some of those things. So as far as all essential oil go, no, there's not evidence on all of it. There's evidence on some stuff for certain things. So I want to highlight some of that here. So one of the main things people use, besides the aromatherapy, right, besides just putting it out there in your air, is for cleaning.
Yes.
And there is talk about
tea tree.
So tea tree, very, very popular. So a lot of talk about tea tree being antimicrobial or antibacterial. Yep. And so not so much, right? So there is some evidence, as this whole analysis will show. Okay, it does have some effect. It isn't very great. All right. And then a lot of what is available in the evidence as far as being antimicrobial, antibacterial, whatever that stuff is, mostly anecdotal. All right. Not a lot of clinical results that are going to be meaningful. Yes. And then from what I found in here is that when you're using it, so mostly anecdotal, and then certainly there's just not a ton of evidence using it on the human body as far as like treating bacterial infections or whatever. And then as far as cleaning, there does seem to be a little bit of evidence there that it does have some kind of antibacterial effect or antimicrobial effect. It's not as strong as household cleansers that say kills 99% of bacteria or whatever the case may be. It doesn't have the same treatment to different species of bacteria and microbes. It has large effects on some species of bacteria, but not all of them. And then the antibacterial effect or antimicrobial effect that it would have on your floors or or your countertops and stuff seems to only last about 30 to 60 minutes. And so
Yeah.
it has something to do with the drying effect. So once you put the tea tree oil down on the surfaces in whatever it's being mixed in, usually it's going to be water and vinegar or something like that. That stuff has to evaporate in order for that antimicrobial effect to take place. Once it's done evaporating, it's all gone. The bacteria species just comes back. However, that's kind of the same thing with anything you're going to buy in the store as far as a cleaning agent goes that kills bacteria. Like once you put it down and it kind of dries up, it'll get rid of stuff, but bacteria comes back. So
speaking of tea tree in particular, the dives that I took off, that I jumped off in, were, like you said, mostly anecdotal, and I couldn't find a whole lot of like hard data that it was like, super convincing. However, and of the essential oils that people tend to be like more allergic to, tea tree is kind of one of those. But I found a lot of people that in the studies I looked at, a lot of people use that for like acne outbreaks. And I think
your
whole thing
ability to segue.
I'm sorry, my bad.
No, your ability to segue is uncanny. Like, can you see it? Can you see?
No, I'm just the everyday man. Take it away there, bro.
Unbelievable. All right. Yeah. Tea tree oil in the treatment of acne. So the efficacy of a 5% topical tea tree oil gel in mild to moderate acne vulgaris, randomized double-blind placebo-controlled study. So this is the type of thing that we want to see. All right. And then just getting right into the nitty-gritty here. So between the tea tree oil group and the placebo group, we see there's about a 30 to 35% difference in the reduction of total lesions and acne severity index.
Cool. Yes.
Right. And then they have the breakdown between the type of lesions. So the pustules, papules, and comedones. Not really sure. So 30 to 35% difference there compared to placebo, which is, I mean, that's pretty darn good. And then, so the question might be like, well, how does that compare to other acne treatments? And so this systematic review and meta-analysis of topical pharmacological, oral pharmacological, physical, and combined treatments for acne, getting down into the results. And of course, that's nice and dark, isn't it?
Yeah.
Can you make those numbers out?
Not if it were a little bigger, maybe, but it's just so dark.
All right. I'll see about Linus. All right. So getting as far as like compared to placebo, now all of these treatments that they looked at are compared to placebo, and then you get the effect size compared to placebo. And so the tea tree oil treatment had about 30 to 35% difference compared to placebo, and that is better than almost all of the treatments that they looked at in this systematic review and meta-analysis. It's all the way up here, right up to chemical peels.
Wow.
So chemical peels had about a 40%, and then photochemical therapy, which is combining red and blue light along with chemicals that treat acne, that had about a 35%. So it's somewhere right in that area. And then the only things above that, they had smooth beam, which is blue lights, photochemical therapy, which is red light only, and then photothermal and photodynamic therapy, and acne care, which is a topical treatment that had about a 81.5% increase over placebo. So for the treatment of acne, that 5% tea tree oil gel, like
it's legit.
It's legit. It's up there with stuff that you're going to get from a dermatologist. So quite impressive. All right. And tea tree oil, like that there seems to be the most evidence on the tea tree oil. I couldn't find a lot of stuff on different things like frankincense and lavender, and most of that's going to be aromatherapy. I did find this one here. randomized trial of aromatherapy on the successful treatment of alopecia areata.
Really?
Yes, alopecia areata is where people lose patches of hair. So alopecia is hair loss. Most people will be familiar with androgenic alopecia, which is male pattern baldness. So alopecia areata is where people lose patches of hair. All right. Alopecia totalis is where you lose all the hair on your head, and alopecia universalis is where you lose it all over your body. So this was a trial of 43 patients. And what they did here is they used a combination of oils. So they used thyme, rosemary, lavender, and cedarwood in a mixture into both jojoba and grapeseed. So all of those things combined, and used it daily on their scalp, and they just massaged it in. And so they found actually pretty darn good improvements in the treatment of alopecia areata for these people. So improved 25, not improved 38, total 63 here. And so the active group, right? So the group that's using the essential oils, 19 of them improved versus 16, which didn't improve, versus the control group, which did not use they used the placebo. Only 6 of them improved. So there was a statistically significant difference there. And we can see in the improvement scores here. So 1 being worse, how many people did worse? So it was the same in both groups. No change. So the control group actually, had more people with no change. And then it's this top left thing here is where you get the key for this bar graph, right? So slight but definite improvement. Significantly different here between the active group. And then market improvement, we see that's about the same. Very good improvement and excellent improvement, both better in the active treatment group than in the control group. And then we can see one guy here had fantastic results. Look at that.
Wow, that's amazing. You sure that's the same guy?
They are reporting it to be the same guy.
He lost some weight too.
It seems like a little bit, huh?
Yeah.
Plus a little bit of weight. All right. So for the treatment of alopecia, now I tried to find comparator for that, and I really couldn't find a good one. What I did find here is a consensus statement by the Australian government on the treatment of alopecia areata. So it does seem that about 40% of affected individuals only get 1 patch, and they'll achieve spontaneous and complete and durable remission within 6 months. 27% of people will develop additional patches, but they'll still achieve complete remission within 12 months. And 33% will go on to develop chronic alopecia. So without treatment, 55% of people with this alopecia areata will have persistent relapsing disease. 30% will ultimately go on to develop alopecia totalis, which is complete hair loss of the head. And then 15% will develop alopecia universalis without treatment. So it does seem that this combination of essential oils in the treatment of that could potentially be an ongoing treatment for people with alopecia areata. So pretty interesting stuff.
And if that proves out, if somebody, it's worth the try. I don't know if you saw all the other chemicals and all the other drugs that they would use that they were showing in their study. It's
yeah.
Holy cow, stuff I can't even pronounce. And it's like that's a lot and expensive too. So man, if that proves out, then that's legit. That's a great thing to do.
Yeah, treatment of alopecia can be quite expensive. And so, again, with that control trial with the essential oils, it wasn't very long. It also does seem to be the case that people with alopecia, especially if it's kind of mild, will achieve remission on their own. So there are some things that go in there, but It is plausible that it could be a daily treatment for people who do suffer from alopecia areata. I might even try it a little bit on my head.
But I thought you shaved your hair that way.
I do shave my head, but it's because I'm going bald. All right. So now on to some of the more cringy stuff here. So I did look up a kind of like an essential oil uses diagram on Google, and a couple of things that kept popping up was gut health, gut health, gut health. Now, a lot of the health claims that are made for essential oils, particularly with gut health, but also relating to most of the other health claims. So this review here does focus on specifically gut microbiota and specifically essential oils, but this does speak to many of the other health claims going into essential oils, which is where we're going to start getting into talking about being careful with these, which you already brought up several points. All of this stuff is only in animal studies. All right. So
That's true.
any
Yeah.
claims made to gut health regarding essential oils and then showing clinical evidence for it is in animal models. And I highlight all these things here. So animal models, rodents, pigs. So most of it's on mice, rats, and pigs. There just isn't very much. It's super, super small, and most of it's going to be just case reports or case studies for the use of essential oils in treating certain things like gut dysbiosis or irritable bowel syndrome or anything like that. So adding it to your food, more than likely, depending on how much you use and what kind, probably isn't going to result in anything. And it may even result in some bad things here. So
Yeah, and so one thing I was reading too is like the strengths that you use it in, and what concentration to use it in. And a lot of what I was reading was, and I can't remember right now, and I didn't write it down, but it goes into there's some essential oils that you probably just shouldn't even ingest in any form, only because like there's not a lot of data there. There's for people, everything's in animals, but what I was reading was that it could inflame your esophagus. That's the most of what I saw was just inflammation in the esophagus, maybe some ulcers in the, like little canker sores in your mouth and stuff like that, but nothing conclusive on gut health, like we were just reading. So
yeah, the stuff on gut health and the stuff on other claims to treating, preventing, or curing other known diseases are not done in humans. It's in animal models, and so you need to be careful with that stuff. And so, going on that topic, the mistake a lot of people make is thinking that, well, these are natural, therefore, right, I can have unbridled use of these things. And the case is not. So you have poison control here. This is talking about essential oils. And so many of the side effects, or if you take this in too much of a dose, it can actually be poisonous for you. So people are allergic to certain oils, and if you put it on your skin, you will develop an allergic reaction in the form of a rash or hives. I did not find anything where anything resulted in something like anaphylactic shock or seizures.
I didn't either.
But a lot of times the most common side effects that people have is nausea, vomiting, diarrhea, dehydration, which is usually due to the vomiting and diarrhea. So putting it on your food and stuff, you need to, I would say, be careful with that, because you can cause yourself to have a pretty bad day here. All right.
Yeah. So like nutmeg, thyme, those kind of things.
Yeah.
Those are great for foods, but not in large quantities.
Yep.
So
Yep. And then, so this one I found to be the most concerning here. After talking about using the blue tansy and other essential oils, so I have a blend called Stress Away. I also use that to go to sleep too. Long-term exposure to essential oils and cardiopulmonary health from a population-based study. And so this study here was a prospective type of study where they gathered a bunch of participants and basically like got information on them over 10 years. So it was from 2008 to 2018. And so what they found is that the higher the use of essential oils, they found that people had higher heart rates, higher blood pressure, and lower peak expiratory flow rate. So basically, how much oxygen you're breathing in and out.
Right.
All right. So getting into this, VOCs are released from essential oils. Now, VOCs, people might be familiar with that term, volatile organic compounds. Those are found in things like paint, solvents, hairspray, different stuff that's aerosolized. Find VOCs. So when you use essential oils, and especially if you use them in a diffuser, the way that I use it and the way a lot of people do it, where you're trying to, make the room smell good, or even when you put it in your mop water, something you mop on the floor, anything like that, you're releasing VOCs. And so what they found here, average age of participants, 42.6 years old, male to female ratio was 1:1. And so the more essential oils that people used and the more exposure they had to them to the per day, so in hours per day, they found that total VOCs were increased. And participants with heavy use of essential oils had relatively higher blood pressure, both systolic and diastolic, higher heart rates, and then also that lower perf. And so getting into it here, so what they found, so you can see in this area here, we have blood pressure. And so people who use no essential oils versus mild, moderate, and heavy, and we can see a commensurate increase in blood pressure and heart rate. But there does seem to be this sweet spot here highlighted in green. So mild use of it, and what they considered to be mild was less than 1 hour per day. All right. So a little bit of use of essential oils seemed to have a small reduction in blood pressure and heart rate, and a small increase, non-statistically significant here, but increase in that perf. And yeah, so this is so what we're missing from this study as far as the use of essential oils, how much you're using, and then regarding the blood pressure and all that stuff, is we don't have a temporal component, meaning we don't know if these people who have the higher blood pressures and stuff had high blood pressure before they started using the essential oils, or if the essential oil use came before the blood pressure, right? You also see in the heavy group here, we have a higher rate of asthma, adenocarcinoma, and acute myocardial infarctions. Sorry, that's heart attacks here. So we don't have a temporal component. What we do have, though, is a dose-dependent response, right? So heavy use seems to correlate with higher incidence of asthma, adenocarcinoma, heart attacks, blood pressure, and heart rate, and also lower lung capacities. So,
I don't know if anybody, I'm sorry to cut you off, but I need to say this before I forget. But I don't know if anybody, if you're watching, then you saw that mild category on both charts. That is the sweet spot. And so my wife and I, we were never really big essential oil people. Coach Lambie actually, and his wife kind of got us interested in it, and we started using it a little bit. But if you buy a diffuser, okay, because we don't ingest anything like that. But if you buy a diffuser and you put a little water in there and you do your little mix, and you fire up your diffuser. I don't know about you guys, but our diffuser is like empty and done at about, I don't know, 20 minutes, 30 minutes tops, and it's done. And that's the sweet spot, is that 20 to 30 minute spot. Don't you agree?
Yeah, so in that trial, it was less than an hour. Now I have a diffuser that has a like a pulse setting where it'll pulse
Mhm.
for 10 seconds and then it'll not diffuse for 10 seconds and then it'll go for 10
Perfect.
seconds. That
Perfect.
well, no.
No?
No. So yeah, so after reading that study, so the more essential oil use people had, the higher total VOCs they had within the air quality of their home. So I think regarding that, that's what a lot of it had to do with was the more you use it, the more VOCs you're releasing into your house, the poorer your air quality is in the house. So people running the diffuser all day in an attempt to,
Ah,
you know,
yeah.
uh, use the antimicrobial properties or whatever the case may be, you're actually probably doing yourself a disservice. And my diffuser, I put that 10-second pulse on things so that it runs all night. So
Oh,
after reading this, now of course we don't know what came first. There's a lot of things, so it could just be that healthier people who have less heart attacks, lower blood pressure and stuff just tend to use less essential oils. And it could be that as people, have heart attacks and their blood pressure goes up and stuff, they turn to more essential oil use because they're trying to limit the amount of medication they're using. We don't know. But, from what I read in there, it gives me enough pause that I'm actually going to use the timer setting on my diffuser and probably just run it for 30 minutes before I go to sleep. We don't use
yeah.
essential oils for much other than that. We don't clean with it and stuff. Oh, another
Right.
thing on the cleaning there is talking with Christy too. I'm trying to tell her about some of the stuff that I find, and she's like, "Oh, well, it's a pretty good degreaser. Like the citrus stuff is good degreasers." It's like, yeah, but not compared to what you can buy. Like it's not not compared to Dawn dish soap.
Right,
you
right.
know.
Nothing compares to Dawn.
Yeah. So we had a lady clean the house for a long time when we moved up here, and then she just got busy. She cleans the rental homes for people. She ended up getting busy, couldn't use her anymore. But she was pretty big into the essential oils, and she would mop the floors and stuff with it. And she thought it was going to take off the floor wax that was on there, never touched it. And so when she stopped coming, I bought an industrial floor stripper, took that wax right off the floor. So, like, does it do some of that? Maybe, but it's not better than, soap and other cleaning agents that you're going to buy. But
Dawn is pretty amazing. It's been a few years, so I may have the brand wrong, but when I was in the fire department, and we would go to like oil spills, the gas station, or just on the street or whatever, we would come out with a water hose with a hose off of the truck, and instead of running um, a full foam load, we would take Dawn dishwashing liquid, and we'd hold the bottle upside down, and we're flowing water, and we just dribble a stream of Dawn into
oh
it,
yeah,
and we're just doing this, and it just broke all that stuff up.
yep,
If I come in from outside and I've got grease all over my hands, maybe it's Dawn. I'm not taking an orange and scraping an orange with my hand to try to get the oil and stuff off. It's great.
yeah,
It's great stuff. Better than an
it's
essential oil, for
yeah.
sure.
The essential oils work for cleaning and stuff. It's not as good as commercial products, and I know a lot of people will use it because they're trying to avoid the fragrance or whatever that's in the soap. Like,
Yeah.
listen, we just talked about the VOCs, and we talked about putting this stuff on your skin, and I don't think that you're avoiding anything by doing that. So by trying to avoid the fragrance or whatever they're putting into the soap, and you're turning to the essential oils, you're basically not achieving anything by doing that. So
Yeah.
they're good for some stuff. I think put it in the diffuser, run it for 30 minutes
Yep.
to an hour a day, I guess.
Yep.
Probably going to be good for relieving stress and good for meditation, good to help you go to sleep, a good for acne treatment, possibly a good treatment for alopecia, to TBD. Everything else, maybe not so much.
Yeah.
So, all right. Are they a total quack? No, not a total quack, but they're also not a total panacea for everything. But that being that, I hope you guys got something from this. Hope some minds were blown. We'll see you guys next time. Coach Lambie and Dwayne out.
See you guys.